Hi, I'm Bailey. I'm going to be your nurse today. I'm going to provide hand hygiene, and I'm going to be inserting the IV into your arm today per your doctor's orders. This is just for any medication that we can't give you through the mouth or any other route here. So I already checked the orders, checked that, and I need your name and date of birth. Obviously, I'm going to check your wristband, make sure it's correct. And then I'm also going to make sure you have no allergies, your wristband shows no allergies, and you don't have any allergies to latex or anything. Awesome. So now I'm going to go ahead and get you like in a good position. So I'm going to raise the bed to a comfortable height so I don't have to bend over. And then would you like to sit or lay? You'd like to sit? Awesome. I'm going to have you sitting up. Perfect. And are you right or left-handed? All right, you are right-handed. So I'm going to look at your left arm and just see if we have any good veins there. And I see two really good veins here. So we're going to use your left arm, your non-dominant arm. So I'm going to have you kind of hang your arm in a dependent position for me while I get my supplies. So this wouldn't be attached. I would attach this, prime it, perfect. Have my needle, which is completely destroyed, my tourniquet, my swab, my tape, which there's no more on here, so I'm just gonna reuse the tape that we had on there. So my tape here, awesome. And then that's for later, and my label. And so now that that's been sitting there, I would have put this on while it was hanging there, but obviously we have to use an arm that's not attached to a hand. So I would apply my tourniquet. And now if the vein wasn't like popping out, this might be kind of tight, so I will remove it as soon as possible if it's uncomfortable. But it is, if the vein wasn't like popping out, I would kind of rub in a venous way. I would tap. I could also apply moist heat for 10 to 15 minutes. But hers are good, so I'm not gonna do that. And then I'm gonna check her site. If there is hair, I would have removed it per the agency policy if you needed it, but there's no hair, so I'm going to continue. So I'm gonna wash my hands and apply new gloves. I'm gonna scrub the area for 30 seconds, back and forth, back and forth, back and forth. I'll come up closer to you so you can see me better. Scrub back and forth, back and forth. And now I'm going to insert my needle now, but our needles, we have no more because they have run out and we accidentally put the protector on this one. So we're gonna pretend the protector wasn't on this one and I'm just gonna pretend it's attached. I'd pull the skin taut. I would go at a 15 to 30 degree angle in. Then once it's inserted, I see flashback. I will insert I would go parallel and then insert 0.5 to 1 centimeter farther. And then I would hold down on here and insert the catheter further in, and while applying pressure, would remove my tourniquet, and then I'm going to attach my stylet here. All right, so then I'm gonna make sure that's clamped, and then I'll unclamp it, pull back, make sure it's, pretend that's staying there, please. Make sure I got flashback, and then I'm also gonna push and make sure it's not infiltrated or like swelling or redness, and make sure it's just, you know, in there correctly. And then I am going to tape it in place. So I would not tape over the hub here because I want to be able to see the flashback if I ever need to do that. So I'm just going to do tape over there. And then I am going to apply my Termideg. You could also wrap this and apply the Termideg over both of them, but for this sake, I'm just going to do this. And then I am going to apply. And before I inserted that, I would have put a protective layer underneath the hands to catch any blood or anything like that. But I'm going to now apply that, and I would do my label here. I would place it over here as well. It would give me the gauge, which I put an 18-inch in. It would be the day I inserted it, so September 6th, the type of catheter I inserted, and then my initials would be right here. And then I would attach any, you know, lapping tubing. I put tape right there so it stays right there. And then I would get rid of my supplies, you know, wash my hands again, get new gloves. And then I would put any solution that the doctor has ordered, I would attach it to my hub here. So I would clamp that, pretend this is staying, that's so annoying. I would clamp that so that it's not going in. I would remove our thing here. I would scrub the hub, attach the IV tubing, whatever it is, and then I would put it back to where it is. I would set the rate of the IV tubing that is needed. or the IV solution that was going in. And per the doctor's orders, obviously. And then I would document that I inserted an IV. I document the time, the date, the site, the location, the solution used to scrub, the IV needle gauge, the type of catheter inserted, and my initials and name and everything like that. And then I had gotten rid of all this. I'm gonna put her back down into the lowest position and then comfortable again. So you're comfortable like that, awesome. So I'm going to wash my hands and then leave the room, obviously. And if you have any like pain, discomfort, it's swollen or red, anything, just let us know so we can get that fixed right away. If the patient was older, I wouldn't have used a tourniquet, most likely. And I would have, if the patient is uncomfortable, I could have used ice or analgesic topical thing or a transdermal injection to kind of soften the stick so they don't feel it as much. And now I'm going to leave the room and then come back. Hi, I'm Bailey. I'm going to be your nurse. So the doctor has prescribed an order to remove your IV catheter that we put in literally a couple minutes ago, but I'm going to remove it. So per his orders, I checked. I'm going to do hand hygiene. Can I have your name and date of birth? Awesome. Check your name and date of birth. No allergies. Perfect. So I'm going to go ahead and remove your catheter. So I'm going to put your bed up again, sit you up where we were at last time, and then I'm going to get a swab, wash my hands, apply clean gloves. I would shut off her IV solution, clamp this so that it doesn't go through. Sometimes remove that. I don't think they usually do, but our instructions, it says to remove this part. And then I'm going to apply taunt traction here to the vein. And I would remove the catheter, apply pressure. I would check the catheter, make sure none of it broke off, that it's all intact right there. I would tape cotton ball to her hand, and I would discard of all my supplies, put her down to the lowest bed setting that she can be at. I think she's already there. And then I'm going to wash my hands. I already did all that. And then I would go out and document the insertion and the removing it. And I would document date, time, location, any IV solution that was running, solution used to clean, gauge, needle size, type, anything like that.